Hi everyone, good morning. I wanted to talk a few words today about brow lifting. Why do I want to bring this up? Because I am asked so commonly by patients, why do I need a brow lift? When that's suggested to them. In fact, the majority of patients that come in to see me never ask for a brow lift. They want their upper lids improved. They want some of the weight, the extra skin and fat that's hanging forward to be removed. So why would someone suggest a brow lift? Why do I think it's important? And how do I think we should modify brow lifting so that it's not so scary for patients and patients understand why it's so important? So let's start with this. The brows and the upper lids, here and here, they act as an aesthetic unit. If I push my brows down, my eyelids become heavy. If I pull my brow up, the eyelids become less heavy. But also, if you lift your brows up, you could look surprised. People don't want to look surprised. They want to look like they used to look when they were younger. So here's the issue. What happens as we age is the eyelids don't just become puffy and hanging and the brows don't just drop. They lose volume and the bone in this area remodels and that causes more loss of volume, and replacing the volume is a completely separate issue. So what we deal with is we deal with the position and the volume. Okay, so why is it important to address the brow? Well, let's start with this. Brow position is critical to eyelid position, as I said. And I think that anyone that has skin beyond the corners of the upper lids deserves to have this elevated a little bit so you don't have to extend the incision and leave a scar. We can typically hide it in a rhyted or a wrinkle, but oftentimes we can avoid it just by lifting the outer brow a little bit. And if most people looked at pictures of themselves when they were younger, that outer brow is a little higher. So you've now heard me use the term outer brow. I also call it the temple brow because it's close to the temple a number of times. Why do I say this? Because in my opinion, I don't even like the term brow lift. I like the term brow recontour because it's not about height. Height makes people look surprised. It's about shape, arch, and contour. I'll say that again. Shape, arch, and contour. That's my dogma. That's what I teach to everybody. I think most people that are having their upper lids done would benefit very well from an outer brow lift or what I call a temple lift. That's not the crazy, huge brow lift procedures that most people do. It's done through incisions in the temple. The incision is between the hair follicles. We use an endoscope or we don't need to. We release the outer brow and lift it. I typically don't cut out skin. Typically you don't have hair loss or other irregularities. And by raising the temple brow, we don't have to extend the incision. We combine it with an upper blepharoplasty to give the most excellent result. Now, oftentimes, if there's volume loss like I spoke of, we could also inject some fat or maybe filler afterwards. I like injecting fat during surgery. But the main point I'm bringing up here is that an outer brow lift or a temple brow lift is not a crazy procedure, is a great adjunct to an upper blepharoplasty and yields the best results, and that lifting the brow is about shape, arch, and contour. Hence, I use the term brow recontour rather than brow lifting. I think it's more acceptable to people, I think it's more realistic to people, and it doesn't lead to that crazy surprise look. The other thing I'll say is I rarely lift the middle part of the brow, this part over here. In about 90% of patients, I just do the temple lift. In about 10%, I raise the middle part too. Why is that? Because the middle part, if you look at pictures of patients when they're young and when they're older, doesn't change too much. It's primarily the outer brow. In addition, when you raise the full brow, that's when you get the surprise look. And finally, the frown muscles that are here, you can cut them when you do a full brow, but when you do that, sometimes they get irregular contractions afterwards, divots, it splays the medial brow, makes it look wider. And all these things are the things that patients complain of afterwards, that strange, surprise, abnormal look. So let's keep it real. I don't think brow lift should scare anybody. I think when done in the hands of an experienced surgeon, a temple lift and upper blepharoplasty is an amazing procedure. If you look at my Instagram page, there's all kinds of before and after results on this. Patients that see that and come in to see me are now asking for this temple lift to be done because they're understanding the concept. Point of this video is just for clarification. A temple brow lift and upper lid blepharoplasty, or what I call a brow recontouring and upper lid blepharoplasty, are critical to get the kind of success that you want and have the kind of look that you want. I hope this was helpful. Have a great day.